This video is for CPAR panel administrators. Please see the CPAR panel resources page with some very important resources, a couple of which I'll point out here. The CPAR roles and responsibility document on page 4 identifies in detail the roles and responsibilities of the CPAR panel administrator. There's links also on that webpage to the Alberta Netcare Learning Centre where you can get how-tos on to use the CPAR web application, as well as in the CPAR forms and guides information, download the guide for the CPAR panel administrator. You might be wondering why keep a confirmed and maintained panel. Remember that your EMR vendor will upload it automatically on a monthly basis. Once the patients are in the system, the participating physician or nurse practitioner receives e-notifications only for their active patients confirmed to be on their panel. Other participants in CPAR, if there is a panel conflict, will see the last visit date and the last day that the care relationship was confirmed in the EMR. Also beginning in June of 2021, Alberta Netcare will display the name of an Albertan's primary provider in the demographics of their Netcare record. If you need some EMR tips, see the EMR resources page. Let's look at upload and download times for CPAR. The vendors automatically upload the panels starting on the 8th with MicroQuest HealthQuest, TELUS on the 10th, and QHR for Accuro on the 12th of the month. After your panel's been uploaded by your vendor, the upload error report is available and the demographic mismatch report is available within 2 days. Starting on the 22nd of the month, CPAR starts to process all the panels that it's received. And by the 2nd of the next month, that is when the CPAR panel conflict reports become available. Understanding that it might be easy to see this in a table format, this is the same information. There is a checklist for CPAR panel administrators in the guide on the CPAR panel resources page. But before your panel is uploaded monthly by your vendor, it should be produced in the EMR and reviewed for accuracy. Importantly, note the total number of patients on that panel. Once it's been uploaded by the vendor, within 2 days you can log in, and first you'll look at your CPAR panel submission results summary. You'll want to see, does that number match what you uploaded, and were any records not processed? Then the demographic mismatch report is available. You can download that report, taking into account your clinic's policies on information in your computers. When you look at the demographic mismatch report, page 1 will list if there are any patients that become deceased since the last monthly upload. The second part lists patients that did not upload to CPAR because their demographics could not be validated. As well, no encounters or consult reports will load for these patients either because their identity can't be matched. For deceased patients, remove the patient from the panel so it's not uploaded again the next month. Understanding that many clinics don't want to mark a patient as deceased until you've received the paperwork, you can do that by changing the patient's status or change the name of the primary provider to blank. Demographic mismatches do need to address, and you need to find out if you need to make a change in your clinic EMR or if the patient needs to update their demographics with Alberta Health. So by the second day of the next month, the CPAR panel administrator will want to get out their guide, log into CPAR, go into the panel report area to download what's called the attachment conflict report. Again, follow your clinic protocol for storing or printing of any information. The first person that will be interested in seeing this is the primary provider and team that works with that panel. You'll also want to follow your clinic processes for managing the panel conflicts. Let's look at the report. Again, these are Albertans that are paneled at your clinic that went to another clinic and they said yes to the panel question. It's not about simply visiting another clinic. What you receive in the report is a list of those patients. You see the date that they were last confirmed in your EMR and visited your clinic. Then for the conflicting provider, it provides the facility, the date that the patient last confirmed in their EMR, and the last date that the patient visited the other clinic. Why address panel conflicts? First of all, coordinating preventive screening care and disease management can be quite a challenge when a patient has more than one primary provider. E-notifications and NetCare will display any provider that the patient is paneled to in CPAR. When the patient is discharged from hospital and the clinic receives an e-notification, there will need to be some coordination where a patient has more primary provider. Also, when a patient has one primary provider, relational continuity will likely increase. And we know from Alberta data that Albertans with high relational continuity to a family doctor are less likely to be hospitalized and have lower mortality than those with low continuity. There is a CPAR panel conflict management approach checklist in the team toolkit, and it's not something we'll go into detail here because you can find that information in the webinar called Panel Conflict Management and E-Notifications. Other tools that are available on the CPAR panel resources page include PCN tools, sample scripts from other clinics, as well as the panel change notification form.